Yebo, yebo, yebo. The difference, a few students have asked me this question. What is the difference between a pharmacist and a medical practitioner, or a doctor and a specialist? Okay. So to become a pharmacist, you study for 4 years, and then you do training for 2 years. Post you okay, after you finish, you then write a national board exam. Two board exams, calculations, and another one is pharmacy related stuff. And after you pass those exams, that is after varsity, during your internship year. After you pass those exams, it's a national. So every pharmacist or every qualified graduate writes that exam. It's a national exam. Personally, I struggled with my pharmacy degree throughout. When I got to write the exam, I aced the exam. So sometimes your struggles are not an indication that you're not supposed to do what what you are studying or what you are passionate about. So the difference between the two, number one, is the content. Okay, the content is different. Pharmacists are focused more on the molecule. Pharmacists are focused more on the pharmacology. Pharmacists are focused more on the drug. Whereas the medical practitioner, he's focused more on the human physiology. He's focused more on the cell biology. He's focused more on disease states. He's more of a clinician. Let me put it that way. That is what a medical practitioner is. He's a clinician. So that is why they are the ones who actually form a diagnosis and actually write a prescription, which is a suggestion, because they understand the disease states much better than anyone in the field. They understand the human body way better than anyone in the field. The pharmacist, on the other hand, is an expert in the medication field. So anything that has to do with medication. So that includes pharmacology. The pharmacist pharmacology is way more advanced than that of a specialist or even a medical practitioner. A specialist of a particular field, the gynecology, focuses on all disease states that are related to gynecology and all drugs that are related to gynecology. But even his knowledge in terms of pharmacology is not as advanced as that of a pharmacist. Just that now we have a lot of rotten apples in pharmacy where people just do it for the money. They do it just to get money and to live in a suburb and to drive nice cars. They are not really passionate. So with those type of pharmacists, you are not going to gain anything from them. They won't be able to explain to you. They won't be able to go the extra mile because they're comfortable. But people like us who are actually passionate about what we do, actually know what we're doing, we will tell you that no, the pharmacist is your main source of information when it comes to pharmacology. Pharmacists, they study over 100 credits of pharmacology in university. Whereas a medical practitioner, go to any medical school. The only medical school that at least gives them a good foundation of pharmacology, in my view, is University of Cape Town, UCT. They do 40 credits of pharmacology in their third year and their fourth year. They do pharmacology and applied therapeutics. Pharmacists across the board do over 100 units of pharmacology. Now, also pharmacology is, for you to understand it fully, you have to understand chemistry. Medical practitioners don't do chemistry of drugs. They don't do chemistry, they are more clinical. So pharmacists, they study the chemistry of the medication, because when you study the drug, you have to understand the chemistry behind it so that you understand how it's made, what molecules or what reactions does it go through to actually form that particular molecule, and what is it composed of, so that you're able to explain to a patient that this allergy of Bactrim is caused by sulfur. And if you're allergic to sulfur, then you're going to react to this antibiotic, to that antibiotic, to that antibiotic. Maybe due to the fact that it's got a double bond of sulfur in this area. And then that will then, if you take any antibiotic that's got double bonds of sulfur, you'll definitely get a reaction, or an allergic reaction. So those kinds of, small details, the pharmacist understands them in depth. Pharmacists across the board, they do over 100 credits, of pharmacology. whereas medical practitioners, they do up to plus minus 40. You check any university. The nice thing now is that you can go online and check at the curriculum. They focus on the physiology. The pharmacist focuses on the molecule, on the research aspect, on understanding in depth how the molecule is made. A pharmacist is the expert in that with that regards. The medical practitioner is also an expert when it comes to the human body. No one can tell him anything. He knows it. The human body, even in his sleep, he will tell you better than any pharmacist. The medical practitioner is your go-to person and your specialist in that particular field. So that is the difference between a pharmacist and a medical practitioner. Okay, so how to differentiate them? Look at their curriculum. What are the building blocks of medical practitioners? What are they trained on? That's number one. What are pharmacists trained on? That's another point. So when you look into that, then you will understand the difference. So that is why the pharmacist is necessary. When I worked in the government hospital, when I used to work with the government, I used to do ward rounds there. And in those ward rounds, you will actually see the role that we play, because they will intervene in terms of drug-drug interactions and recommending better alternatives and better treatments for the patients. You find a patient is been taking certain medications, but the condition is not improving. But because of a second eye of a pharmacist, the pharmacist will be able to micro-scrutinize the whole prescription and the medical history, and will be able to give advice in how they can improve the whole situation. And the whole scenario will change. The patient will improve, the patient will be healed. So that is the difference. It's the curriculum that actually produces both of these professionals that makes them different. And their role is to work together to improve the common denominator. Danko.